We are the Group 1 and we're going to present about the schizophrenia. We're going to present the definition, examples, local statistics, signs and symptoms and diagnosis, treatments available, legislation, subsidies available for clients, local resources for clients that suffer from the illness. For the definition and examples, in the year 2014, the World Health Organization defined mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. If the person's mental health is not stable, it will lead to many mental illnesses. According to Stanhope Lancaster, Chisa Falchini, and Viverais Dressler, states that 1 in 5 Canadians will experience mental illness in their lifetime, as cited in Health Canada in 2006. The other 4 will be affected by the mental health of a friend or from a family member. Therefore, mental health illness can affect individuals of all ages. For the definition, according to National Institute of Mental Health in the year 2016, schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It's also people with schizophrenia may seem like they have lost touch with the reality. In addition, schizophrenia, according to Schizophrenia Society of Canada, one of the many challenges in developing effective treatments for those suffering from psychiatric disorders, including schizophrenia, is that these disorders are multifaceted in nature. They are likely triggered through a complex set of interactions between genes, environmental exposures, and developmental insults. These interactions are currently poorly understood. Examples is, in someone with schizophrenia, the most basic processes of perceiving and thinking are affected by the illness. Every individual with the illness will have a unique experience of the world, but they are common things. That's according from Harrison in the year 2019. In the local statistics, in the schizophrenia in Canada, the number of cases of schizophrenia per 1,000 population, there are 3.86 in Canada, and outside Canada there are 2.55. And number of cases of schizophrenia per year per 100,000 population, in Canada there are 25.9, and outside Canada it's 11.8. Therefore, we can see that in Canada, schizophrenia is really common case. And look out.
Hi there, my name is Irandeep and I'm a member of Group 1, and our topic of presentation is schizophrenia. And I will be presenting schizophrenia sign and symptoms and diagnosis. In schizophrenia sign and symptoms, we can say that schizophrenia changes how people think, feel, and act. The symptoms of schizophrenia can come and go, and they usually start between the age of 16 and 30. Men get these symptoms much earlier than women, and when the disease is in full swing, the person cannot tell when the ideas that they are having are real or not. In the positive symptoms of schizophrenia, there are highly exaggerated ideas, perceptions, or actions that show the person cannot tell the difference between real and not real. In these, there are hallucinations, and in these hallucinations, people might hear, smell, see, or feel things that no one else does. So these hallucinations are auditory, visual, olfactory, and tactile. And in delusions, these are false beliefs that the patient with schizophrenia can have. And these are persecutory delusions. In this, the person feels like something or someone is after them, and they are being stalked or hunted down. And then there are referential delusions. In this, the person feels that public forms of communication like television and radio, they have a special message just for them. And in somatic delusions, the person thinks that they have terrible illness or bizarre health problems, like they have some kind of worms under their skin. In erotomanic delusions, the person is convinced that a celebrity is in love with them or their partner is cheating on them. In religious delusions, some people think that they have a special relationship with God or demon and they speak to him or her. In grandiose delusions, they consider themselves as major figures in the world. And the person can also have confused thoughts and disorganized speech in schizophrenia. They can have trouble concentrating on talks, conversations, and they can also have movement disorders. They can be really jumpy or they can make repeated movements. And then there are negative symptoms. In the negative symptoms, there is absence or lack of normal or mental functioning. There can be lack of pleasure, trouble with speech, flattening. In flattening, you will feel like the person, when the person is talking, their voice is really flat and there are no emotions in their voice. There can be withdrawal, and the activities or conversations they used to enjoy before, they will be withdrawing themselves from those activities and conversations. They can struggle with basics of daily life, and there can be no follow through, and that means that they will have a trouble staying on schedule of certain things. There can also be cognitive symptoms and thinking problems. The person with schizophrenia might have hard time with working memory. Also, it will be hard for the person to organize his or her thoughts and make any decisions. And in diagnosis, we will see that there are three things that are used to diagnose the schizophrenia. First is physical exam, second is test and screenings, and the third one is psychiatric evaluation. In the physical exam, it is done to rule out any other problems that can be causing these symptoms, like alcoholism or any kind of substance abuse or any head injury. In test and screening, it includes the tests that help rule out conditions with same symptoms, and also screening for alcohol and drugs. And in this, the doctors can order MRI and CT scan for the person. In the psychiatric evaluation, physicians and mental health professionals check the mental status by observation and asking questions about thoughts, moods, delusions, hallucinations, substance abuse, and also the potential for violence and suicide. It also includes discussion of family and personal history, as family history is really important in schizophrenia, as the schizophrenia can run in family as well, so they have to take into consideration if any other family members of the person are showing the same kind of symptoms or have shown the same kind of symptoms in the past. So this is all for my topic, and the rest of the topic will be covered by my group mates. Thank you so much.
Hi everyone, my name is Marvic and I will be discussing treatment options available for schizophrenia. Currently, there is no method for preventing schizophrenia and there is no cure, but there are good and effective schizophrenia treatment options, and recovery of quality of life is possible. Treatment options available are the following: psychotherapy, psychosocial therapy, first generation antipsychotic drug, second generation antipsychotic drug, and electroconvulsive therapy. Psychotherapy. It is a kind of talk therapy that will likely also be a big part of plan to help them understand and manage their symptoms. Types of psychotherapy include individual psychotherapy. The therapists and psychiatrists teach the persons how to deal with their thoughts and behaviors. They learn more about their illness and its effect, as well as how to tell the difference between what is real and what is not. It also can help them manage everyday life. Cognitive behavior therapy. The therapist will show them ways to deal with voices and hallucinations. With a combination of cognitive behavior therapy session and medication, they can eventually tell what triggers their psychotic episodes and how to reduce or stop them. Cognitive enhancement therapy. It teaches people how to better recognize social cues and improve their attention, memory, and ability to organize their thoughts. It combines computer-based brain training and group sessions. If a person with schizophrenia sees improvement during psychotherapy sessions, it's likely they'll need more help learning how to become part of a community. That's where psychosocial therapy comes in. Types of psychosocial therapy include social skills training. This type of instruction focuses on improving communication and social interactions. Rehabilitation. Rehabilitation may include job counseling, problem-solving support, and education in money management. Family education. Your knowledge of psychosis and schizophrenia can help a friend or family member who has it. Research shows that people with schizophrenia who have a strong support system do better than those without the encouragement of friends and family. Self-help groups. You should encourage your loved one to participate in community and outreach programs to continue working in their social skills. Coordinated specialty care. It's a team approach that combines medication and psychological therapies. It includes social and employment services and tries to include the family whenever possible. Assertive community treatment. This offers highly personalized services to help people with schizophrenia and life's daily challenges, like taking medications. ACT professionals also help them handle problems proactively and work to prevent crises. Social recovery therapy. This treatment puts the focus on helping the person set and achieve goals and building a sense of optimism and positive belief about themselves and others. First-generation antipsychotic drugs. These medications block a brain chemical called dopamine and are more likely than second-generation antipsychotic to cause significant movement disorder like intense muscle stiffness or a condition that may develop over long-term exposure called tardive dyskinesia. Second-generation antipsychotic drugs. These newer medications are less likely to cause certain side effects than the first-generation antipsychotics. Electroconvulsive therapy. In this procedure, electrodes are attached to the person's scalp. While they're under general anesthesia, doctors send a small electric shock to the brain. Each shock treatment causes a controlled seizure. A series of treatments over time leads to improvement in mood and thinking. Schizophrenia is a serious mental illness that affects a person's thinking, emotions, relationships, and decision-making. And because there is no cure, getting the proper treatment early is the best way to improve chances of managing the illness.
Hello everyone, myself is Mandeep Kaur and I'm from the Group 1. We were given with the topic schizophrenia and my part is legislation in schizophrenia. Mental health legislation is necessary for protecting the right of the people with mental disorder as they face stigma, discrimination and marginalization in all the societies, and this increases the likelihood that their personal rights or human rights will be violated. So therefore mental health legislation is essential because of the unique vulnerabilities of the people living with mental disorders. Mental health legislation is concerned with more than cure and treatment, and it provides a large framework to address critical mental health issues and illnesses, and it helps to deal with the issues such as access to care, rehabilitation and aftercare, and as well as full integration of the people with mental disorders into the community and the promotion of mental health in different sectors of society. There is no specific legislation related to only schizophrenia in Canada, so the legislation covers all the mental disorders such as depression, schizophrenia, mania, and other related disorders. There are two specific pieces of legislation that govern how people with mental health conditions receive care and treatment. So the first is Mental Health Act and the second one is Mental Capacity Act 2005. The first Mental Health Act 1983, it was updated in 2007, so it's also known as Mental Health Act 2007. This act sets how a person can be admitted, detained and treated in hospital against their wishes and details safeguards which ensures patients' rights are upheld. So basically this act gave us the idea how the people with schizophrenia are detained, treated in the hospitals against their wishes, but also taking care of that their personal rights are not violated. And the second one is the Mental Health Capacity Act. This act allows somebody to make a decision on the behalf of a person aged 16 or over in their best interest when the person lacks the capability to make decision for themselves. So basically this gives an idea how to make the decision on the behalf of someone else when they are unable to take the decision for themselves. In mental health legislation, there is different kinds of approaches. So the first one is dispersed legislation. In this approach, there is no specific legislation related to only mental disorders, and it provides provisions relating to the people with mental disorders are inserted into the other sectors of care. So in this approach, the legislation includes other sectors of treatment that are for the general public as well. This approach is not used much in most of the countries. However, the second approach, consolidated legislation, this is very intact and easy to adopt, and in most of the developed countries like in Canada and America, this is the approach used for the mental health legislation. In this, all issues related to mental health disorders are incorporated into a single legislative document. So in this approach, the legislation only covers relating to the mental disorders, not other general disorders are included in this one. In mental health legislation, there are different components. There are two types of components of mental health legislation. So the first one is substantive provisions for mental health legislation. In this component, it helps to protect the rights of the people living with mental disorders such as schizophrenia. Under this section, there are 10 subcomponents. So the first is the principle of least restrictive alternative. This means that the person should be provided with the treatment in the community who is suffering from schizophrenia or any other mental disorder until unless there is a harm to self or a risk of harm to the others. So in that case, they should be treated in any institution. Confidentiality, the person's information should be kept confidential. Third one is informed consent. The person who is getting treatment should be provided with the proper knowledge regarding their treatment, rehabilitation, voluntary and involuntary admission. In most of the cases, there should be a voluntary admission. Since it happens like there could be chances for involuntary admission when the person is not able to take the decision for themselves. So in that case, involuntary admissions can happen, but then there is also need to take care of the rights of the people who is receiving the treatment or admitting into the hospital. The next one is voluntary and involuntary treatment in the hospital settings, involuntary treatment in community setting, periodic review mechanism, competence, accreditation for professional and mental health facilities, rights and roles of families and carers. The next substantive provisions for other legislation impacting on mental health. So in this component, it helps to protect the rights and promotes and prevention of the mental disorders. In this component, the people living with the mental disorders or schizophrenia are helped with the housing, education, employment, social security, criminal justice, civil and general purpose legislation, general health care legislation, access to psychotropic medications, protection of vulnerable groups, restricting access to alcohol and drugs. So the next one is Canadian Mental Health Association. In Canada, the Canadian Mental Health Association is the only association that addresses all aspects of mental health and mental illnesses. It helps to address the mental illnesses by promoting and advocating through strong connections with policymakers, mental health consumers, families, educators, caregivers, and the other services providers. The next topic is subsidies available for people living with schizophrenia. In Canada, there is no as such any kind of direct support available for the people living with schizophrenia. However, they are supported through different resources available in the community. There is different organization in the community that help to support people with mental disorders. So in regards to that, we do have like the Canadian Association for Supported Employment, Psychosocial Rehabilitation Canada, and Ontario Disability Network helps to find the job for the people. They do educate the people, and with the mental disabilities, they help with the rehabilitation and their living back into the community. So in my part, I covered the legislation, which includes the Mental Health Act and the Capacity Act and the different approaches and the subsidies available for the schizophrenia. Thanks.
Hi, my name is Sandeep Swatch and I'm in Group 1. Our topic of presentation is schizophrenia. My topic is, what are the local resources for the clients that suffer from schizophrenia? So for the local resources, the first resource is SSO, that is Schizophrenia Society of Ontario, which includes Ask the Expert, which includes web and telephone support. Ask the Expert assists people living with schizophrenia and their families across Ontario through telephone, online, and in-person support. ATE, Ask the Expert, is staffed by a team of trained mental health counselors who provide customized supportive counseling and advice on the mental health system in Ontario, and connects people to local resources and services available throughout the province. All the questions and responses are private. ATE offer information for the people dealing with first episode or the new diagnosis of schizophrenia, persistent ongoing situation of schizophrenia, and other related mental illnesses. That's what included in SSO, that is Schizophrenia Society of Ontario. And the next resources are inpatient mental health services. So inpatient or residential services are required when people need constant medical attention and monitoring. For example, if they are a risk to themselves or to others, and violent behavior to themselves or to the community. Someone experiencing mental health issues like schizophrenia may choose to be hospitalized voluntarily. The doctor may recommend treatment at a community center as opposed to a hospital. And the other alternative to the hospitalization, if the person has persistent mental health issues and require constant monitoring, as just like a hospital, and it includes assertive community treatment, that is ACT team. It is more or less similar to hospital. It also provides a care, 24-hour care, which includes professionals, doctors, nurses, and social workers. So this ACT, it focuses more on the mental health issues for the clients suffering from schizophrenia. So these are the local resources for the clients that suffer from this illness. It includes SSO and inpatient mental health services. So that includes my presentation. Thank you very much.